Hi, I'm Nicole, and this is my specimen collection video. So I would first start off by donning gloves for getting any sort of specimen. And I'm gonna start off with the urine Regent strip, which is just your random urinalysis. Always wanna make sure that the expiration, the bottle is not expired, so check the expiration date. And it's basically just the strips out of the bottle. You get a urine sample from the patient, and you just dip this into the urine, wait the desired amount of time. Each one of them have a different amount of time. They range from 30 seconds to 2 minutes, and you would just let it sit, and then you can compare it to the left side of the bottle is the norms. So that's for a UA. The second type of urine specimen would be a urinalysis with culture and sensitivity. That is usually for a clean catch. It comes in a kit. You would have a female patient use the wipes and wipe from front to back 3 times. Usually start a stream, stop the stream, and then start a stream again and catch that. They would put it in a sterile cup, and once they hand it to you, you want to go ahead and make sure that you label it and send it off to the lab. If it is going to sit around for more than an hour, it definitely does need to be refrigerated. So a urinalysis CNS determines the type of bacteria growing in the urine and the antibiotic to treat it. The next sort of type of sample would be a stool sample. This would indicate if there was any sort of blood in the stool. Basically, the patient gives you the sample. You go ahead and use the sticks and you swab and use the 2 blocks onto the card and swab and smear, and then use the opposite side and swab and smear. You close the card, flip over, and follow the directions. You go ahead and use the developer that comes with it, and you place 1 to 2 drops, wait 30 seconds, and any trace of blue would indicate that there is some sort of a bleed. Could be either from hemorrhoids, a GI bleed, or possible liver disease. The next thing they would do after that would probably be a colonoscopy or an endoscopy. The next type of, back to the urine. So if I wanted to get it off a Foley, a specimen from the Foley, you would clamp the tube with a rubber band, wait 15 minutes. After waiting the 15 minutes, you would come back with an alcohol pad and wipe here for at least 30 seconds. Using a needle and syringe, you would go ahead and extract at least 30 mLs, and the most would be 120. Again, putting this into a sterile cup, covering it, labeling it, and sending it off to the lab. The next type of specimen would be a sputum specimen. So that is basically just having the patient cough up some sputum. We want it from the lungs. You would sit the patient up as far as they can go, have them take a few nice deep breaths and cough, and hopefully they would get it right into the cup. You cover it, label it, and get that off to the lab as well. And here I have a swab to do test for strep throat, a rapid strep test. So this, you would basically just have the patient open their mouth, and you don't want to touch the side of the mouth, the side of the cheeks, or anywhere in the mouth. Just try to get to the back of the throat in the area that's the most inflamed, red, or a white spots. A nice swab, and then back in the tube, label, and off to the lab. And then there's also a nasal culture that they would do, and you would test for flu or MRSA. That would the swab would be inserted up the patient's nose, especially for the flu. You want to get up there and put back in the tube, labeled, sent to the lab. But sometimes those are done rapidly in an office. And same thing for MRSA, just swab and test for MRSA. And I think that's it. Thank you.